Make sure it is safe to approach the child. Check if the child is responsive.
He's not responding. Call an ambulance.
Activate the emergency services if the child is not responding. Check for breathing for up to 10 seconds or signs of life or movement.
He's not breathing.
If the child is unresponsive and not breathing or gasping, begin CPR. Start with compressions. You should be kneeling next to the child on a firm, flat surface. Put the heel of your hand on the breastbone in the center of the chest. Give 30 compressions. Push straight down at least 5 centimeters with each compression. Push hard and push fast. At the end of each compression, let the chest rise back to its normal position. You should be giving almost 2 compressions every second. After administering 30 compressions, you need to open the child's airway. Opening the airway correctly will help keep the tongue out of the way to make sure your breaths are effective. Put one hand on the forehead and the fingers of your other hand on the bony part of the chin. Tilt the head and lift the chin backwards slightly. It is important to avoid pushing on the soft part of the neck or under the chin, as this might block the airway. While holding the chin open, pinch the nose closed. Take a normal breath. Cover the child's mouth with your mouth. Give 2 breaths. Blow for 1 second per breath. As you give each breath, you should look at the child's chest to see if it rises. After giving the 2 breaths, return to the position to give compressions. Continue the cycle of 30 compressions and 2 breaths until qualified help arrives or until the child shows signs of life. If the person is an infant under 1 year, the procedure stays the same. Instead, we use 2 fingers on the center of the chest, just below the nipple line for compressions. Push down at least 4 centimeters at the same rate of almost 2 compressions every second.